So now, if we flip the coin and we look at the impact of psychological safety on workforce, what we can see is that it affects retention in the workforce. Right? We see a whole lot of doctors and nurses and mental health professionals that are actually exiting the professions, exiting early or exiting altogether. And it also can impact recruitment into the profession. It impacts the mental health of residents, of practicing physicians and healthcare professionals, and especially those who tend to occupy marginalized identities. So just to share a little bit about that personally, when I was in residency, during my second year, looking back now, I suffered from functional depression until it was functional, until it wasn't. And so one day after call, I was sitting on my bed and I happened to have a bottle of Percocet from a knee surgery that had happened several months ago, still there. And I remember sitting, looking in the bottle and thinking to myself, time to quit. And now when I look back on that time, there was a progression. There was a progression from day to day. But what I remember is never feeling safe to share that with anyone. And the reason was because I had seen the impact of one of my colleagues who had shared honestly about a past struggle with mental health that got him sidelined for 6 months. So they took him out, and for me, that communicated indirectly, because communication's not only the words, but the things that are around us and what we see, what's modeled to us, that it wasn't safe to share when I'm struggling. And so fortunately, my classmates and I were close, and I felt safe enough to reach out to one of my classmates, two of my classmates, and that got me to where I needed to be here today.